welcome back into the show. The Hamilton Center has been servicing the Wabash Valley area for 50 years, and now they're sharing their free suicide prevention program with organizations interested in learning more about what they can do to assist people in crisis. And here to talk all about it is Tiffany, Sherry, and Missy Burton. Hi, guys. Thank you for being here.
Thank you.
Thank you.
Oh, anytime. Now, can you tell me a little bit about Hamilton Center and what you guys do?
Absolutely. We have been in the Wabash Valley for 50 years now. We cover a 10-county area, all the way over to Indianapolis, and then both in, north and south of Terre Haute. But we do a lot of community mental health services. We're doing individual family therapy, addiction services, adult services, and we do a lot of crisis assessments, and that's one of the reasons why we're here today, is kind of talk a little bit about how to help folks access those services.
And I know during the times of COVID, I've had to check my mental health, and because it can just kind of throw you off. What are some things that people can do to kind of assess themselves?
Well, right now, a term we're hearing a lot is COVID fatigue, because individuals have been taking safety precautions for quite some time now. I mean, we're coming up on a year. And so really it's to give yourself a break when you're starting to feel some of that fatigue, so that you can recognize in yourself what's going on. Give yourself a break, do some self-care, check in with somebody else to say, I need to tap out for a minute, can you help? Like, really asking for help is so important.
Okay, and what about the effects of it on, not only adults, but also children?
Well, a lot of times with, our kiddos, particularly the little ones, they don't understand COVID-19 when you hear some of those phrases, but they hear it a lot. And so when we have a bad day, we're irritable. When they have a bad day, they're irritable. But sometimes as adults, we don't allow them that time of irritability, or maybe they're going to throw themselves on the floor and have a temper tantrum. But that's how they express to us how they're feeling. And so rather than telling them to stop, it's more, thank you for sharing that with me. Thank you for sharing your big feeling, and just sitting with them, more skin-to-skin contact, this quiet conversation with them, controlling your own breathing and your own response, and helping them then slow their own breathing down and just share those feelings with you.
So can you tell me, how would we approach the topic of suicidal ideations?
Part of it is to do it with boldness. And that is so hard, because often I've had people tell me that I'm afraid to ask the question because I'm really afraid of the answer, and they're not sure what to do. So part of it is, Tiffany's going to talk about some of the training that we're going to have, but to get involved in that training, but to know that you can just simply say, I've noticed a change in you. I'm concerned. Are you thinking about hurting yourself? Are you thinking about hurting somebody else? Using the word suicide, and knowing that your responsibility is to help them get connected with somebody. Your responsibility isn't to be their mental health provider.
So tell me about some of the training that's going to go on.
Well, as you said before, that in recognition of our 50 years of providing service to the community, Hamilton Center is offering free suicide prevention training to all of our 11 counties in which we provide services. So we are offering two different trainings for our within those service areas. And the first one is QPR, which stands for Question, Persuade, and Refer. And in that training, what you will receive is how to recognize those warning signs and how to get someone to help. And the second program that we're offering is for middle school and high school age students. And we want them to be trained, and also the staff within the schools. And as a component in that training for parents too, because parents play a big role in that, and we want parents to be able to recognize those signs with working with those students. And we talked about that COVID fatigue.
Absolutely.
Within the home. And parents are spending lots of time with their children in that home. So those are the services that we're offering, that training that we're offering to the community. And it's not only for organizations that are community partners with Hamilton Center, but it's open for anyone within the communities.
That's awesome.
Within those 11 communities. And I know that we always forget about Knox, but we're also in Knox County too. So we're just asking if anyone has an interest that they can go to our website, and I know you have that information.
Yes.
HamiltonCenter.org, and look for community training, and then you'll have that option to sign up for QPR training or SOS training. And as soon as you do, someone will contact you to schedule that training.
Okay, and really quick before we go, I just want to ask this one quick question, because I feel like sometimes when we talk about suicidal ideations, kind of the people who have those thoughts feel shamed in bringing up the conversation if they were ever thinking about talking to someone. What would you tell someone if they, and I know this is probably embedded in your program, but can you give kind of quick advice to anyone who is possibly thinking about it but kind of backed away because you have this image in your head that they're just going to toss you in a hospital and never let you out, or anything like that? I think there's a really big stigma around it.
Absolutely. Part of it is knowing that you're not alone. I mean, we have a whole crisis center, our access center, that is centered around helping folks who are in that very situation. And so to have, they can walk right into our front door. They can call the number, which is going to be on your screen, so that they have someone right then and there to talk to. Those services are now available 24 hours, so that if it's the middle of the night, they can still call. They are not alone. There's no shame in it, and the struggles right now are just increasing, and we have to make our awareness increase. We have to not be afraid to ask hard questions. We need to reach out to those that we love, and then we need to be able to come forward to say, I'm struggling. So often as caregivers, we're the ones who are like, I have to hold it together because I have to take care of you, but then that only has more of a negative impact. We have to make sure that we're taking care of ourselves as well and asking for the help that we need.
Awesome. Thank you so much for being here.
Absolutely.
You guys feel free to come back anytime.
Thank
and you guys don't move and visit that website. We will be right back with more Good Day Live.